DiFranco. I am a faculty member with the University of Baltimore and also the program director for the undergraduate health systems management program. I was always very interested in biology and the health sciences, and with the encouragement of some of my teachers was kind of guided in that direction. So I pursued the nursing career initially. I think the turning point probably in my nursing career that encouraged me to go to law school was the fact that we had a patient who had come in with a very serious bleed in her brain. The physicians and nurses had a very difficult time arriving at the decision to honor her wishes, which was not to be on life support. And I realized that I could be even more of a patient advocate if I were to pursue a career in the law. I had always aspired to be an attorney, but wasn't sure whether I really wanted to do it. I applied, and much to my chagrin, I got accepted and completed law school, and then went to work as a litigator in the healthcare department doing medical malpractice cases, and I also worked on the healthcare regulatory side as well. I was a nurse for many, many years, close to 20 years. I practiced nursing in the emergency department and trauma care while I attended law school. So I was a full-time law student as well as practicing every weekend in the emergency department. It was very challenging, but there's a light at the end of every tunnel, and I saw that light at the end of 3 years. And then ultimately I realized that something has to give when my daughter was born. So I cut back on my nursing side and continued in the practice of law. I received a phone call, I think it was on a Tuesday or a Wednesday, from a colleague of mine, a law colleague of mine, who said, I have a law partner who has to teach a class at University of Baltimore in health law. However, he can't make it. Can you take the class for him? And I said, sure, thinking I had weeks, months to prepare. And I said, when does the class start? And he said, this Saturday. Well, I hesitated for a moment, but then I decided, let me give it a whirl. So I did. And although frightening, it was a wonderful experience, and that's when I got bitten by the teaching bug. And so that's how I did the transition from nursing to law, and then from law to teaching. So I've really been with University of Baltimore for about 14 years as an adjunct professor. The program director who preceded me asked me to teach a class here at Shady Grove. USG was unknown to me for a very long period of time. When I came to Shady Grove, I was so excited. It is a beautiful campus, wonderful facilities, and that's how I learned about USG. So part of my mission to go back is to educate people about Shady Grove. Not only our program, but that Shady Grove is a full-service campus that provides an array of services to the students that attend here. I think there are many other students out there who could benefit from our undergraduate and graduate program. So we prepare the student for a management position, and that's really the focus of the program. So they have a wide array of choices. They can work in hospitals, acute care facilities, they can work in long-term care facilities, they can work for insurance companies, they can work for universities in teaching. So my vision is to network, to develop relationships with healthcare employers in the area. I always encourage the students to do internships because that is a perfect way to explore a career, to network with potentially future employers. I tell my students to take care of each other, to support each other, and to share with each other, because you never know. It could be 5 years, 10 years, 15 years. You may run across one of your former classmates, and if you've developed that wonderful relationship with them, they could be instrumental in getting you to the next level of your career goals. So I always tell everyone, you must take care of each other as you go through this process of education.